A very pleasant good afternoon here. I'm Dr. Pavitra. I'm doing my DNB residency from Mahatma Hospital, Trichy. I'm here to present a rare case of a late onset drug-induced choroidal detachment. These are my co-authors. Starting with the introduction, early choroidal detachment occurs very shortly after trabeculectomy and glaucoma drainage surgery if there is an overfiltration. Its occurrence rate was reported to be around 20% in trabeculectomy and 16% in glaucoma implant surgeries. Late onset choroidal detachment is a very rare complication in this clinical settings. But previously in literature, it has been reported that anti-glaucoma medication itself can cause a choroidal detachment without the prior surgery. But there has been no mention about the ripasudil causing a spontaneous choroidal detachment. Here we have a case, the 64-year-old male who came for us glaucoma review, and he has no history of any comorbidities. He was on two anti-glaucoma medication, namely the bimetoprost and ripasudil. His uncorrected visual acuity was 618 in right eye, 69 in left eye, and the best corrected visual acuity was 6 in both eyes, and the near vision was N6. Coming to the anterior segment examination, he has grade 2 cataract in both eyes, and the posterior segment shows glaucomatous optic atrophy in both the eyes, and his IOP was measuring about 16 millimeters in right eye and 19 millimeters in left eye with Goldman applanation tonometry. His visual field shows a mean deviation of minus 26.65 in right eye and 27.83 in left eye. So we arrive at a diagnosis of advanced primary open-angle glaucoma with glaucomatous optic atrophy in both eye, where left eye shows more severity when compared to right eye. So we are advised for a cataract extraction with PCIL implantation and trabeculectomy with mitomycin C in the left eye. The surgery went uneventful, and 1 week post-op review, the patient came. He had the anterior segment finding showing a deep anterior chamber with a flat bleb and surgical iridectomy scar, and the best corrected visual acuity was 6.6, and his IOP was under control with 13 millimeters of mercury with no AGM. 2 months post-op visit, the patient came and the same anterior segment findings were there, the same visual acuity, but his IOP was increased from 13 to 18 millimeters of mercury. So in order to achieve the target IOP and considering a severe visual field defect, we restarted him on bimetoprost and ripasudil, which he was all using previously before surgery. And we asked the patient to review after 2 weeks, but the patient lost a follow-up. 2 months later, he came with a complaint of blurred vision in his left eyes for the past 2 weeks. So the anterior segment shows a shallow anterior chamber, and his visual acuity has been decreased from 6 to 612, and his IOP has dropped to 5 millimeters of mercury. His posterior segment, the fundus examination shows a choroidal detachment, and we did a B scan, which shows 360-degree choroidal detachment. It's a serious choroidal detachment. So we advised him to stop the ripasudil eye drops in left eye, and we started him on topical steroids hourly and systemic steroids at the rate of 1 milligram per kg body weight, and we tapered the dose over 6 weeks. Later, after 1 week of this treatment, we reviewed the patient, and the anterior chamber became deep and with a flat bleb. His vision improved from 612 to 6.9, and his IOP was under control. The fundus and the B scan showed the resolving choroidal detachment. Furthermore, the patient didn't experience any recurrence after the choroidal detachment, and this is the picture showing the fundus and the B scan before and the after treatment. So in our case, though it can be argued that the choroidal detachment here is caused by ripasudil alone, it did not precipitate the attack in the first place, but it could be an idiosyncratic reaction with the other agents like the bimetoprost, which is already using. The fact is that the condition started showing a reversal of its symptoms after stopping the ripasudil eye drops. So this indicates a causal relationship between the two, and moreover the other medication, the bimetoprost, which he was using for a longer time. So only the ripasudil eye drop was recently added. So the best method to prove this causality is to re-challenge the patient, but re-challenging may not be ethical, and sometimes it failed to produce the event. So in conclusion, this is a late onset choroidal detachment by topical ripasudil when it was started on the setting of hypotony. So it resolved on withdrawing the ripasudil eye drops and initiating on the topical and systemic steroid treatment. So these are my references, sir.
So if you withdraw even the bimetoprost, do you think that it would have resolved on its own?
Yes, sir, but we thought of first trying out with the ripasudil. So with ripasudil, if it is not settling, we thought of withdrawing both ripasudil and bimetoprost. So we tried first with the ripasudil. With that itself, the patient started showing symptoms. The choroidal detachment was resolving, sir.
how many months is it post trabeculectomy surgery?
It was 2 months post surgery, sir.
2 months.
Yes, sir.
Okay. So is it mentioned in the literature that following a trabeculectomy,
Yes,
the
sir.
choroidal detachment can happen either in the immediate post-op or
Yes, sir. It
late
is there in
post-op?
the literature, but immediate post-op is frequently seen, but late post-op it is
It's
very
rare,
rarely.
but it is still seen,
Yes,
right?
sir. Yes, sir.
So, like, is it a possibility that the patient has rubbed his eyes, or there is a mechanical injury to the bleb and there is an overfiltration for a few minutes, which has induced? I'm playing a devil's advocate because before accusing a drug
Yes, sir.
of causing this,
Yes, sir.
we need to ask.
Yes, sir. We inquired with the patient, but patient didn't show.
Yeah,
he
usually
didn't
they
give his
won't know,
sister.
but in the sleep they might have done. That is one thing. So yeah, it's an interesting case because there has been talk about this repository causing certain issues.
Yes,
But
sir.
before actually pointing a finger at a new drug,
Yes, sir.
it would have been good if you have just stopped repository, not started steroids.
Okay, okay, sir.
Because now even if you have continued the drug and started steroids, it would have been the steroids can take care of the CDs very well, especially post-trap.
Okay, okay, sir.
Those things. Maybe if you had tried that, still you could not have blamed the drug, but at least it would have been, somewhere
Oh.
near that. Okay. Yeah. Thank you.